Are you ready for the lockdowns? Well, you better be if Joe Biden gets in office. This article, of course, is from yesterday. Stocks, of course, rising higher. U.S. can expect increased testing, a national mask policy, and possibly a nationwide lockdown. This, of course, once supposed president-elect Joe Biden takes office. And so for the longest, people have, this is basically what Donald Trump was talking about. This is the election choice between a Trump boom and a Biden lockdown. Says while insisting that the pandemic is taking a turn for the better. Right? It says here, while insisting that the pandemic is taking a turn for the better, though the data suggests otherwise. So for those who don't know, I do work in a hospital. I've been a nurse for the past 8 years. And of course, there's been different, of course, therapeutics. You might be familiar with Remdesivir. Remdesivir was the drug of choice by the FDA, which of course is produced by Gilead. A lot of this, of course, is motivated obviously by money via the stock market. And so hydroxychloroquine that was originally pushed by different doctors overseas in China, of course, was spoken of by the president, Donald Trump, and that immediately got shut down because hydroxychloroquine is obviously a very cheap medication that pharmaceuticals, of course, don't benefit from at all. And then everybody, I don't know how many doctors came out and praised Remdesivir. And then, of course, not too long later, right, on multiple, over different periods of times, even as far back as April, all the way up until October, Remdesivir fails to prevent deaths in huge trial. Of course, you can go through all of these articles. I've read several of them that, of course, even the World Health Organization says that Remdes has little to no effect. And ironically, I remember one day I came in and I had this 95-year-old patient. And of course, Remdesivir is a very expensive treatment. It's $500 a day. So, and it's over 6 days. So it costs $3,000 for the treatment for those who have this right here, right? So and of course this is paid for by the American people. And then of course it gets revealed that it has absolutely no effect on the virus and is basically wasted. So then one day I came in, I had this 95-year-old patient, and the doctor comes up to me and is like, "You have so-and-so," and they were like, "Just to let you know, the patient is admitted to the unit, but we more than likely believe that the patient is going to die today." And I was like, "But why are they admitted to this unit?" And it's because the person needed an ISO bed. And then, of course, while I'm medicating the patient, of course, I'm administering Remdes. And then I'm thinking to myself, this is such an expensive treatment for someone who is literally going to pass away tonight. And this is what I said in that video that unfortunately got taken down, that the government has, especially hospitals have no incentive, of course, for saving the taxpayer money. Now, this is a 95-year-old patient. And again, I'm not against obviously giving medications to patients if it's going to help them. But if you are a physician and you do realize, you look at the labs, you look at the status of the patient, you realize the patient's medical history, you look at the patient's age, and you realize that more than likely this will be this patient's last hospitalization. This is the hospitalization that is going to take this patient down. Realistically speaking, from a cost perspective, if you were looking to save the taxpayer money, you would not utilize such an expensive treatment on someone that you realize is going to die that evening. But that's political, right? That's the political / pharmaceutical battle that Trump had been speaking of for quite some time, which is why he was pushing to lower the cost of American drugs. And of course, Trump, his administration, of course, is trying to get pushed out in favor, of course, of Joe Biden on lockdowns. Now, with that said, recently, of course, Pfizer came out with the news that they had a stable vaccine that had a 90% efficacy rate. Pfizer then, of course, stated that they in no way, shape, or form had any sort of anything to do with Trump and the administration in terms of money that was given out to many different companies, like, for example, Merck, Moderna, and of course, Pfizer. And Pfizer explicitly denied any sort of workings with Donald Trump. And of course, this all came out very conveniently after the election, of course, with the mainstream media stating that Joe Biden had won. And then, of course, the following day, of course, they have to retract, right? Because it came out that they, of course, were not telling the truth. Pfizer is proud to be one of the various vaccine manufacturers participating in Operation Warp Speed as a supplier of a potential vaccine. So, of course, previously they had admitted, they had said they had absolutely nothing to do with this individual. They were basically trying to backpedal in every way, shape, or form, and stating that we came up with this on our own. We didn't have anything to do with so-and-so. We're fully in favor of the other candidate. And this is what happens within the mainstream media. Ironically, I'm watching Pfizer yesterday, and of course, Pfizer's vaccine is so welcomed by the market that the stock sells off 10% on the news of the vaccine. As you can see, with a gap up to 42, it was trading at 36. This is about a 10% drop. It's about a 10% drop in the stock. Yet we are yet to believe that, of course, this is the supposed vaccine that is going to save the American people. Now, in the previous article here that I spoke about, right, where it says this election is a choice between the Trump boom, and of course, I did want to cover what it said right here, where it says, though the data suggests that it's not, right? In terms of, right, Donald Trump said that with his presidency, the economy and the country would see a boom moving forward, as of course he is not in favor of lockdowns. And of course, Joe Biden is, of course, in favor of lockdowns, as he said, if the science says so. But realistically speaking, they need a way to slay the beast, right? They need a way to slay this beast right here, right? So, of course, CNBC, of course, says that the data suggests otherwise. So let's take a look at the data, right? So according to the CDC, as you can see right here, right, hospitalizations. And I've pointed this out previously in the past, right? So as you can see, the hospitalization rate is dramatically decreasing, right? It's on the decrease. In terms of, it's literally making lower highs, as you can see right here. And this is, of course, is according to the CDC. This has been going on. This information, of course, is available for anybody that can just simply Google. But no one ever talks about hospitalizations. The only thing that they talk about is this. And like I said in my video that unfortunately got taken down by YouTube, it's very easy, of course, to fake swabs. Swabs are very easy. They have a high percentage of false positives. But you can't fake hospitalizations. You can't fake people coming in to the hospital for the most part. For the most part, it's very difficult to fake hospitalizations, which is why when you stop and just actually take a look at the numbers actually tell the story. The media does not give you the truth of what's going on, of course, with the virus, right? So even though the media will say that the data suggests otherwise, what they're always referring to is swabs. They're always referring to positive PCR tests. They're not referring to actually people who are seeking medical treatment. Because as you can see from the data, that the number of people that are requiring medical assistance is decreasing. It's been decreasing over quite some time. And so when when this individual says that the virus is almost gone, that it's literally disappearing, the data actually shows that. What the data doesn't show is, of course, swab interactions with people. But in terms of people actually requiring hospitalization, in terms of people actually requiring medical assistance, the data is in favor of what this individual said right here. That, as he said here, it says, I would be prepared to do, as it says, that the data is of course indicating that the virus is basically on the cusp of disappearing. What really is the problem is, of course, PCR swabs. And of course, like Biden said, he says, I would be prepared to do whatever it takes to save lives because we cannot get the country moving until we control the virus. And according to the data, how much more control can you get in a country where it's 5%? I mean, now I believe according to the hospitalization rate, it's 6.4%. I think they said with the nearest highs, with cases spiking out of control, but the hospitalization rate didn't even jump 1 point. It didn't even jump 1%. And again, like I've showed in previous videos, that the hospitalizations that they refer to are typically geriatric patients, like just like in England and of course in Ireland. Literally, you can look anywhere around the world, in Belgium, that the hospitalization of such patients is typically of geriatric patients that are around 70 to 80 and above years old. And many of these individuals come in for things like heart failure, diabetes, changes in blood pressure, failure to thrive. I don't know how many times I get, some 90-year-old person and I get report and they're like, yeah, the patient came in because they have a low appetite. And it's like, well, they're like 90 something years old. And they're like, well, I don't know why my grandmother doesn't want to eat. And it's like, because she's dying. And of course, that's difficult for many in America to understand. But that is the reality of many of these individuals who are being hospitalized. And then, of course, they test positive and they get thrown in and they get lumped in with the statistics of increasing rates, right? And so many of these individuals that are in the hospital, if they were actually honest, they would give us, of course, more information. You'd get age and what the patient was admitted for, not just what they tested positive for, because that's not necessarily that relevant. It doesn't matter if the person tested positive for the virus, if the person isn't in the hospital for the virus, or if that person, of course, is not showing any signs or symptoms in any way, shape, or form. And so this is why when you listen to the mainstream media, it's important that they're really not even giving you any sort of accurate information. They're not even trying. It's not like this information is actually difficult to find on the internet. You can literally find this information with just a simple Google search.